Well, we are here now with Janelle Burton of American Senior Communities, and we're going to talk about physical therapy, the importance of it, especially for people who are suffering from incontinence. Good to see you.
Nice to see you too.
So explain what that is and how the therapy helps.
Sure. Incontinence is the accidental or involuntary loss of urine from the bladder. Therapy can help in multiple ways, which we'll discuss. But it is something that can make a difference within 6 to 8 weeks and resolve a lot of the problems.
I think that's really good for people to hear, because when you have that diagnosis, you think, there's nothing I can do.
Right.
So how does the therapy work?
Well, there's 4 main types of urinary incontinence that we talk about. The 4 most common types are stress incontinence, which is like when you sneeze or cough or laugh and you have a little leak then. That is caused by pregnancy and childbirth, menopause, and men after prostate surgery often have this problem as well, but it's completely treatable. The next type is urge incontinence, which is pretty much, I gotta go and I gotta go right now.
Gotta go right now.
Yes,
like the commercial
so we can also treat that. That is really common after C-section, which I think is important for a lot of young women to hear that feel like they shouldn't be struggling with that problem yet, but they are. So if you've had a C-section, it's very common after that. But it can also be caused from aging, strokes, and other neurological disorders. The next type is chronic retention, which is when you don't feel like your bladder is completely emptying right after you go to the bathroom. You feel like you have to go again. You might dribble right after you go to the bathroom. These people have to strain to get their urine out. They have chronic UTIs. They often wet the bed at night. A lot of problems like that, and that's normally caused from some sort of underlying medical problem, prolapse of your internal organs,
something more serious.
Yes, something more serious. Exactly.
And physical therapy then strengthens? So
we can do strengthening of the pelvic floor muscles, as well as electrical stimulation, dolphin stim, which I've been on before talking about, which is micropoint neurostimulation. It's a lot like acupuncture, but it is different. There's no needles involved going in the skin. And then we can do bladder retraining exercises as well. One important thing to note is a lot of places that treat urinary incontinence use internal methods where it's very personal, getting very involved personally. They're going internally. All of our methods we use are external, treating points that are distal. So it's not quite as embarrassing as some other places that you might go. I'm not saying those methods don't work, but this is just much less invasive. We treat points that are on your abdomen and your back and your wrist and your legs, which link to all that, rather than internally inserting some sort of stimulation.
Well, that's interesting to think about, that, you know, that your arms and legs play a part in that.
Right.
Because it's frustrating and it's embarrassing, and people feel like there's nothing that can be done.
Right.
You know, short of surgery.
Right. And there is stuff that can be done.
And do you practice all of these therapies there at is it Mount Vernon?
Yes, in Mount Vernon. We can do it both inpatient and outpatient. As long as you have a doctor's order, you can come see us and you don't have to live with us.
Inpatient, outpatient. And I'm sure you're seeing great results, or you wouldn't keep repeating this therapy.
Right, yes, we've seen great results with it.
So if you have questions, just call.
Right. My phone number at Mount Vernon is 812-838-6554. All of our American Senior Community buildings offer this service. So if you live in Evansville or Newburgh, call one of your buildings there and they can get you scheduled for it.
Thank you, Janelle. Great information and hopeful information, too. Thank you.
Thank you.
We'll be back with more Lifestyles right after this. Stay with us.
This portion of Lifestyles is brought to you by American Senior Communities.